COVID data on campus. But first, I want to talk about yesterday's announcement about our plans for fall semester. The Chancellor announced yesterday that we're planning for a fully in-person campus experience this fall. Here's what that means. Teaching in classrooms at capacity, return to normal campus housing, reopening all of our dining halls and facilities, fully staffing student services, offering a comprehensive slate of student events and programming, and preparing for full capacity at our athletic events. You know, it's hard to believe it's been a year since this pandemic began. All across campus, our students, faculty, and staff have done a wonderful job adjusting to the challenges that COVID-19 has presented us. You know, it's exciting to think that we're so close to the turning point in this pandemic. I'm going to turn to Dr. Gregg now. Dr. Gregg, you and I have been in a lot of meetings this semester and in the fall semester where we've discussed how to prepare for the time after the pandemic. Can you talk about why we are comfortable announcing plans to have a fully in-person fall semester?
Certainly. Good morning, Dr. Zomchik. Happy Big Orange Friday. You know, it's great to be at Tennessee Vol. It's good to be with you again this morning. We are so appreciative of how our students, faculty, and staff have made sacrifices over the last year, and those dividends are so obvious now. But despite this great work, we still know and continue to hear over and over from faculty, staff, students, and parents how much more effective and meaningful the education process can be when we're together, in person. And with the improvements that we're seeing across our community, state, and nation, and with the greater availability of the vaccines, we feel it's imperative for us to be prepared for a regular fall semester. As we have from the beginning, we'll continue to follow the guidance of local, state, and federal health officials if circumstances change. And we feel certain that if called upon, our students, faculty, and staff who have so admirably adjusted their behaviors, routines, and expectations during the pandemic, they'll step up and do the same again. So while the university, faculty, and staff will continue working from now through August to prepare for a regular fall semester, simultaneously, because we're all fully aware of the uncertainties associated with the pandemic, our emergency operations staff will continue to plan for any necessary contingencies or mitigation efforts. Essentially, as with any emergency preparations, you hope for the best, prepare for the worst, and remain flexible. And that's what we'll continue to do as we gear up for a regular fall semester.
That sounds perfect. So as we remain flexible, what will you be looking for this summer? What will you in the Emergency Operations Center be looking for as we make decisions about what fall semester will look like and what the guidance we're going to give to our campus community?
We'll certainly continue to closely monitor our community positivity rate and cases per 100,000 in anticipation that decreasing trends there will remain. We'll be monitoring local hospitalization data, especially as it relates to COVID-19 infections. And most importantly, we'll be looking at vaccine availability, access, and administration, and continue to encourage everyone to be vaccinated as soon as possible. We'll then couple this information with local, state, and federal guidance on appropriate mitigation efforts, and then move forward on setting up the safest campus environment for our faculty, staff, students, and visitors.
Thank you, Dr. Gregg. You know, we've said a lot about how grateful we are to our faculty. And I want to just say how grateful I am to you and to all of our personnel who've been monitoring conditions around the area and on campus to help us make sure that we keep people safe, and at the same time to put in place planning that's going to allow us to have the fall semester that we all want. You know, we're very excited about the future. We've heard from our students how difficult it is to stay connected when they have a fully online course schedule. And I've heard from faculty as well that they miss those intangible benefits that come when you have students sitting in front of you, when you have students talking to one another before and after class. I'm looking forward to seeing a return to our classrooms being populated again. You know, these plans are possible because of the distribution of the COVID-19 vaccine. We've been administering the vaccine here on campus, both to eligible members of our campus community and to the public. Dr. Gregg, how's that distribution going here on campus?
Well, I'm here again this morning at the Student Union. We're having another Moderna vaccine clinic, including yesterday's Student Union vaccine clinic and this morning. We're at about 1,000 second doses of the Moderna vaccine in the past 24 hours. We're also continuing to provide vaccines through the Student Health Center on most weekdays. In total, we've provided approximately 5,000 vaccinations on campus so far this semester. We're also excited that next Friday, March the 19th, at the Student Union, we'll be offering up to 1,100 doses of the Johnson & Johnson's Janssen vaccine, which is the one-dose vaccine most recently awarded an emergency use authorization by the Food and Drug Administration. We'll continue to provide vaccine access through the remainder of the spring semester, and we'll be working with local and state health officials on how we can best assist our community and our state at its vaccination efforts through the summer as well.
Thank you, Dr. Gregg. You know, this really does sort of embody the volunteer spirit, the fact that we're offering this to our community as well as to our campus population. It's great news. All right, we're going to shift gears now. We're going to talk about recent data. So here we go, ladies and gentlemen. As of this morning, we have 43 positive COVID-19 cases. 38 are students and 5 are employees. We now have 242 people in quarantine or self-isolation. This includes 128 students who live on campus, 92 students who live off campus, and 22 employees. Now I'm going to say a word about clusters. We've identified 2 new clusters since last week's update. One is the Alpha Delta Pi house. Like previous clusters identified in sorority houses, this cluster was designated as such because of the living arrangements inside the house. The cluster includes 1 positive COVID case and 23 close contacts because of those living arrangements. We want to thank the residents of the house for their cooperation with contact tracing and quarantining. The other cluster occurred when 67 students attended a ministry retreat organized by a community group for UT students. Contact tracers have now identified 10 COVID-19 cases related to the retreat and 74 total close contacts. This is the largest cluster we've identified this semester, but we're confident that our contact tracers have been able to fully assess the situation and have helped mitigate further spread. In coordination with the organization that held the event, we've been in touch with all students in attendance and we've advised them to quarantine. I want to use this as a prime example of why it's extremely important to continue to follow all current safety guidelines. Please limit the size of your gatherings, wear masks, practice social distancing. For your health and for the safety of others, we need to keep our guard up. We're so close to a turning point in this pandemic. Now is not the time to let down our guard. So let's turn now to testing data. Last week, we collected 3,050 samples. We tested them in pools of about 3 to 5 samples each. Out of the 758 pools, we identified 6 pools and 29 individuals who were referred for diagnostic testing. Of those who were tested, we identified 4 positive individuals, 3 residential students and 1 commuter student. The overall participation rate for residential students, unfortunately, dropped again this week to 50.8%. Our positivity rate across all samples was 0.13%. I said the participation rate has continued to drop every week, and we need to do better. That's not acceptable. I want to remind everyone who lives on campus that your participation in the testing is required. If you have not already, you will soon begin seeing consequences for failing to participate in the community saliva program. I want to turn to Dr. Gregg again with a question. Dr. Gregg, how confident can we be in our low prevalence rate with only half of our students participating in the community saliva program, testing program?
As our participation rates on campus have decreased, so has our confidence in the reliability of our data. We really need to see participation rates with our community testing in the 70 to 80% range to have more confidence in those numbers, especially our campus positivity rate. And since the positivity rate is such an integral part of our strategic planning from week to week, these low rates of participation are making it really difficult on loosening restrictions further. We want to begin opening up, but in order to do so, we need that confidence in our data. And in order to gain that confidence, we've got to see improved participation from our students.
Thank you, Dr. Gregg. I can't emphasize enough what Dr. Gregg said. We want to open up, but we can't do it unless we have your cooperation, your participation. Participating in the community saliva testing program is for us as important as continuing to maintain all the health and safety protocols that are in place. Please help us keep the campus safe and open back up again so that we can all enjoy the beautiful spring weather that's coming and we can really beat this pandemic once and for all. So I'm going to turn now to a metrics summary. Let's look at them. And as a reminder, this table includes indicators that we use to evaluate whether to tighten or ease the restrictions that we've just been talking about. Dr. Gregg, how are things trending in our broader community?
With the metrics that we routinely monitor, our numbers are either trending down or staying about the same. Our 14-day average of new cases in Knox County is holding steady. Hospital bed capacity is improving. New cases on campus are trending down, and we're seeing the same with active cases. We've seen a slight increase in our number of self-isolations related to both on-campus housing and off-campus events, where a number of close contacts and positive cases were identified and required some to isolate or quarantine. To this point, we're pleased with what our data is revealing, but obviously we don't want to see any increases. So it remains important for everyone to continue with mask wearing, social distancing, hand washing, and all the other health and safety strategies that have been so successful in curbing the pandemic.
Thank you, Dr. Gregg. We are really proud of what the volunteer community has done, how you've stepped up and how you've followed the directions that we're getting from our health experts. I hope you'll continue to do that. We're at the end of another live update. I hope that you can enjoy the spring weather before the rain comes. I also hope that you'll cheer on our men's basketball team, especially this afternoon, as they take on Florida in the SEC tournament. And I hope to all the students out there that you're through your midterms and head into the last half of the semester with the intention of finishing strong. So that's all for today. And as we say here on Rocky Top, go Vols!